Hi, good evening, everyone. Could you give me a thumbs up if the audio visual is fine and I'm good to go? A quick nod if the visual and the audio, everything is fine and I'm good to go. Let me just see. Hi, okay. Thank you. Good evening, everyone. Sorry, I think the chat got stuck. All right, thank you so much. Hello, everyone. Hello, Dr. Swami. Med, hello. Krishnapal Singh, hello, good evening. Dr. Swami, again, good evening. Skid Assassin, hi, I'm good. Thank you so much. Yogesh Tama, good evening. Mohammed Zafar, good evening. All right, everything is fine. Excellent, excellent. Awesome. This session is in continuation with all the previous sessions, as you know, that we've been doing starting from general pharmacology. So now this is another session about CNS, respiratory, and GA. We are doing the MCQs based on the previous year questions, and we're going to talk about the important topics in general. Good evening, Hanuman. Good evening. यही बात है and more focus I'm going to lay on CNS and few questions on respiratory and general anesthesia as well, right? Awesome. Chalo. So before I start the mandatory announcements which I have from the Unacademy platform, so let me just give that to you first. The first one is about the NEET PG Vitals. Now, anybody who is not appearing in current batch, yes, it is for FMG. It is specifically targeted for FMG, but even somebody who is preparing for NEET, which is to be held later on, they can also actually make best use of it because it's an overlap of all the topics. It is definitely actually this is special. I've made these sessions only for targeting FMG, so I can finish by the first week of July all the important topics on pharmacology. Yes, Twinkle, good evening. Okay, so this is about the NEET PG Vitals. Now, what are these NEET PG Vitals for those who do not know? These are your recorded sessions of all the 19 subjects. So anybody who's appearing after a few months, so let's say not current, unke liye though it won't be helpful right now, who's appearing right now, but yes, if you're appearing after 5 or 6 months and you want a quick revision of these videos or recorded videos, you can actually go through these vitals. So these are all the recorded videos that you get, very comprehensive, very targeted approach and concise matter of all the 19 subjects. And then you will also get the clinical based questions, the PYQs, so IBQs, so everything is packed together in one NEET PG Vital. So you can subscribe now from it by going at the Unacademy platform. The next one is about the next, whether it is your next 23 or your NEET PG 24, whatever happens, we have already, this is a batch which is already started from June 21st, and it gets a very focused, laser focused approach towards targeting towards this NEET PG or the next exam, where you have different classes for 400 plus hours and 200 plus classes, particularly targeting these exams, and you can get at a very competitive price of 7600. So you can subscribe again to this, or anybody currently who wants to give exams, your NEET PG test series, which are very important for your revision. I believe when you appear for multiple mini tests or grand tests, you know what happens, it enhances your performance because you know where your fallacies are, you know where your drawbacks are, and this is the time you can correct that, so that when you go finally appearing for your exam, you don't make those mistakes, because sometimes you're very good in your subject but you don't know how to manage the time, so that you will fumble. So this is a very good practice for that also, how to manage your time, how to attempt your questions, so that you can make the best of both these things. So I would advise that you can give a lot of tests. So here we have 4 mini grand tests and 1 ultimate grand test, which is almost simulating your final exam experience. So make use of this and go ahead and do as many tests as possible right now. Because repeated revision right now is what you need, and to put that to actually test how you know that you recall things is by giving the tests, right? Good evening, Prakhar. And the last one is for revision, which is your high yield revision batch. Again, as I focus right now, someone who's appearing, anybody who's preparing on 30th of July for the FMGE. So currently your focus definitely is revising as many times. Multiple revisions are what is required right now. So you can make use of this, 1.5 months offer. And what you do is it's a high yield batch for the FMGE 2023 here, and live mentorship. You get any doubts, you can ask there and then, clear your doubts, be confident, and it's your choice whether you go for live lectures or you go for the the recorded concise revisions. That is up to you, but you can make the best use of it by being with your faculty and being in touch with them, and learning together or revising together. That's the best thing I can say right now. So these are all the few offers that I had to inform you about, and anybody interested, please go ahead and make the best use of it. So now coming back to the topic for today are your MCQs. And again, as I say that I want everybody to participate. I'm all good, Clayton. Thank you so much. I want everybody to participate and ask and keep the chat box buzzing. आता है नहीं आता है, let it be secondary, but what is important is for you to participate, because that helps you gain more confidence. Frontier batch 1. You can just subscribe. I think it is there. It is for 1.5 months. You can act or call this number, Twinkle, the number which is shown 85. They can give you more better details, right? Just call this number 858585 and you will get all the details, right? Sure. Now, the first question for the day, let's start with that. Theophylline causes diuresis by phosphodiesterase E4 inhibition, adenosine or 1 receptor antagonism, beta 2 agonism, or phosphodiesterase 3 inhibition. No, this is not my first session. I've already done Twinkle with the general pharma, ANS, we have done CVS, we have done endocrine. So this one is CNS, and the next we'll be doing antimicrobials. Hello, Dr. Metroid. Yes. Okay, so I'm getting the options. So most of you are at 2, Sunny is at 3, Muhammad Jafar is at 1, Dr. Metroid also says 2. So most of you are getting this correct. So the correct answer is diuresis is caused by which mechanism? Diuresis is caused by adenosine 1 receptor antagonism. That's the correct option. Okay? So phosphodiesterase, it is not a specific phosphodiesterase inhibitor, theophylline. Okay? So remember that. So let's do a little bit about these drugs which are used in bronchial asthma. So because this drug is about bronchial asthma, and just briefly about the classification of the various drugs. Okay? Now, the drugs which are used for and mechanism, as I said, especially for FMG and the mechanisms are asked quite a lot. So lay a lot of stress on the mechanism. So you know what mechanism, what drug acts. Okay? This is the first, yes, was the first question, and that's the first slide. Yes, Dr. Metroid. So classification of drugs. Okay? So classification of drugs. Yes, we'll do that. Yes, Chandni. So first is your anti-IgE antibody. That is because we go from like top to bottom. Let's see what happens. Is omalizumab. Okay? Omalizumab. That's the question. Yes, I'll discuss that definitely. Mast cell stabilizers, we have sodium chromoglycate and ketotifen. Okay, mast cell stabilizers because they inhibit the degranulation of mast cells. Leukotriene antagonist, which inhibit the action of leukotriene on its receptors. Montelukast, Zafirlukast. So the question asked is whether are they helpful in acute cases? No, they are not helpful in acute cases. They will not be only better for prophylaxis. Then come your major drugs which are going to be effective in your acute attack of asthma. Okay, so here we have your bronchodilators, which are the star drugs for managing the acute attack. Okay, star drugs for managing the acute attack. So beta 2 agonists, which are the most important here. Salbutamol, terbutaline, Short-acting beta agonists. Formoterol, salmeterol is long-acting beta agonists. So these are your drugs which are your beta-2 agonists. Then you have your methylxanthines, theophylline, aminophylline, doxyphylline. Now, anticholinergics also cause bronchodilatation, which is epitropium, tiotropium, but they are beneficial only, or we give them only in patients who are on beta blockers. Let's say for some reason we cannot give beta-2 agonists, then we give anticholinergics as such here. The second part of the asthma is to decrease the inflammation, because it is inflammation of the bronchial area or the bronchial pathway. So the first हमने चीज कर दी, we have immediately relieved the patient of bronchoconstriction by causing bronchodilation. So that target is achieved. Second is we want to decrease the inflammation also. For that we give drugs which can decrease the inflammation, and the best drugs available for anti-inflammatory effect is your corticosteroids. So we prefer corticosteroids by the inhalation route, very targeted approach and less side effects, of course. So only serious patients when we can go to systemic corticosteroids. Otherwise, we prefer the inhalation route only. So beclomethasone, budesonide, fluticasone can be given. So these are some of the important drugs that are important to know about bronchial asthma and how they work. Okay? Yes, you can tell me. I can. This is actually would be a small. Is this not clear? You can wait. See this if it is clear. Let me know if it is clear. It will be a little, I think. Is it not clear? It's clear. It's clear. All right. Thank you for confirmation. Right? Okay, it's clear. Much better. So actually, if you can, when you can watch the recording later on and just enlarge on it, it will be much clearer. Yes, I'm going to talk about that right now. Okay. Now let's get to the important points about theophylline. So we know that theophylline works by phosphodiesterase inhibition, and it works by adenosine 1 antagonism. Now the important ADRs that you should know or you should remember, which ADRs by what? So phosphodiesterase inhibition, that can lead to nausea, vomiting, that can lead to headache, and that can lead to gastric discomfort. A1 antagonism can lead to diuresis, which was the question asked, and it can also lead to seizures. While both of them together, this both mechanism can lead to arrhythmias also. So remember this, phosphodiesterase inhibition. P से पेट खराब, so gastric discomfort. D से दिमाग, सिर में दर्द, दिमाग में दर्द, सिर में दर्द, remember it causes headache. E से emesis, it causes nausea, vomiting. So remember that these three toxicities can be because of the phosphodiesterase inhibition. The rest two, diuresis, seizures, is or SAD, you can remember. Let me change the color here. ठीक है, seizures and diuresis is because of adenosine, or adenosine can cause seizure and diuresis. Both leads to arrhythmias. That's important thing. Another thing I want to emphasize for theophylline is one of the drug, ठीक है, theophylline is one of the drug that can cause which is actually a target for therapeutic drug monitoring. थेरेपोटिक ड्रग मॉनिटरिंग, ठीक है, थेरेपोटिक ड्रग मॉनिटरिंग हम वो करते हैं विच हैव अ narrow therapeutic index. Drugs which have a narrow therapeutic index, they require therapeutic drug monitoring. So can you name the other drugs which have a narrow therapeutic index and they can, are the let's say the targets for therapeutic drug monitoring? Any other one? Any other drugs? So these are the most important side effects to know. Don't go here and there. The most important यही है जो पूछते हैं. So please stick to this, which is important, right? Other drugs which very good. One is lithium. Aminoglycosides, okay. Or no, magnesium, sir. Digoxin. Warfarin, actually, yes, warfarin can be measured with the help of INR. ठीक है ना? Warfarin के लिए we have a standard that you measure the INR. So TDM उसके लिए required नहीं होता. So they have a different measure. Digoxin, very good. Phenytoin. ठीक है? Valproate. So these are your important drugs which require therapeutic drug monitoring that you see. So ये एक question आता है in targets or indications. FMG, I'm targeting FMG because it is near, but NEET PG can also be. Questions थोड़ी change हो जाएंगे. Questions remain the same, Sunny. So whether, because FMG is near, so we are covering in topics. But yes, definitely you can benefit from this because same questions आते हैं. Pharma will not change whether it's for FMG or it is NEET PG. जो कुछ टॉपिक्स डिफरेंट होते हैं एक्चुअली देयर बी FMG में जो आएगा दैट इज फॉर नीट पीजी में कुछ हो सकता है देयर इज समथिंग व्हिच इज नॉट रिक्वायर्ड फॉर FMG बट अदरवाइज वर्सा इज नॉट ट्रू एनीथिंग व्हिच इज इंपॉर्टेंट फॉर FMG इज इंपॉर्टेंट फॉर नीट पीजी. So these are the drugs which have narrow therapeutic index and they require therapeutic drug monitoring. Now what I want to ask you, what is the drug of choice for acute attack of asthma? Drug of choice for acute attack of asthma. Yes. Drug of choice for acute attack of asthma. Drug of choice for acute attack of asthma. Fast. Yes, it is. Okay, beta 2 agonist. Now it is it is a fast acting. Actually, though it is a long acting, formoterol is a long acting beta 2 agonist, but F for fastest, ये fastest acting भी है. So we prefer to use this, but not only this. We use it along with inhalational corticosteroids. So currently we use it along with inhalational corticosteroids. ठीक है? It is a long acting beta agonist, but long acting तो one thing है, it has a fast onset of action also, faster acting also. So it is currently preferred for this because एक तो fast act करेगा and it will stay for a longer time. Then what is to be given if the patient, drug of choice for patients on beta blocker. Drug of choice for patients on beta blockers. What will we give then? Because we cannot give a beta 2 agonist. So as I said before, what will we give? We will give anticholinergics. Then we are going to give anticholinergics. Okay, so whether it is your bronchial asthma, exercise induced asthma, those kinds we all give. Yes, we give anticholinergic drugs like जो हमने अभी बात किया ipratropium, tiotropium. All right. Now coming to the next topic is identify the sites. यहाँ पे can you identify the sites? This is site A here. Site of action तो है, identify करो, and then about the drug. Which are the drugs which act on site A? Which are the drugs which act on site B? Esmolol, it is the shortest acting. असर कैसे करेगा? Esmolol is for arrhythmia. It is the shortest acting. Specific for bronchial one. Tolcapone, very good. For site A is, Tolcapone is currently not used वैसे, ठीक है? So yes, but you can mention the name. Tolcapone and entacapone. Right. B, very good. It is carbidopa. Carbidopa, tolcapone, entacapone, and carbidopa. Then we have other drugs like dopamine agonists. ठीक है? Dopamine agonists like ropinirole, MAO-B inhibitors like rasagiline. ये बाकी other drugs हैं for anti-Parkinsonism or for Parkinsonism. ठीक है? Let's discuss quickly about these drugs. Tolcapone has been withdrawn. Why? Tolcapone has been now withdrawn. Why? क्यों withdraw कर दिया गया? Very good. It is hepatotoxic. Hepatotoxic. It has been withdrawn. Yes, very good. Now, out of tolcapone and entacapone, which acts both in the brain as well as the periphery, which only acts in the periphery? Out of tolcapone and entacapone, which has action both in the brain as well as in the periphery, and which has only action in the periphery? Tolka both, very good. It has both actions on the, matlab action, site of action is both periphery and the brain. And see, if one of the drugs, carbidopa both, अगर carbidopa both होएगा, then it will not allow levodopa, क्या करेगा वो levodopa का, carbidopa होगा. So for levodopa को आगे dopamine में change नहीं होने देगा, ठीक है? अगर carbidopa acts, I'm talking about अभी तो COMT inhibitor, but if I'm talking about carbidopa, it is only a peripheral action. It only has a peripheral action because we do not want levodopa to convert into dopamine in the periphery, but we want levodopa to convert into dopamine in your brain. If you are going to do that, if carbidopa also has a central action, then levodopa will not be able to convert into dopamines. Remember, levodopa is a prodrug. So, uska jo active form hai, that is your dopamine. And why we don't give dopamine as such? Because it cannot cross the blood-brain barrier. So, we give levodopa, which crosses your blood-brain barrier, and in the brain it converts into dopamine. And then it will be effective in patients of Parkinsonism where there is a dopamine deficiency. So if carbidopa happens to have action also in the brain, so remember it will also block the conversion of levodopa to dopamine in the brain, and that we do not want. So carbidopa only has a peripheral action. It's only a peripheral decarboxylase inhibitor, remember. Correct? Power of Islam. I hope I made this confusion correct. So carbidopa is only in the periphery, not in the brain. If agar brain mein ho, then we will not require that. We cannot use that. Now, let's do some quick questions on this. So, can you tell me the most effective drug in Parkinsonism? All these quick shots which I mentioned actually are also the MCQs they have been asked. So, rather than putting them as MCQs, let's do one-liners. Ki if there are no options given, can you answer even then? Because that means you know the answers. Whether koi bhi option pucha jaye, so you know the answers. Most effective drug in Parkinsonism. Effective drug. एक होता है कि व्हाट इज अ ड्रग ऑफ चॉइस, मतलब हम कौन सी देते हैं. वेरी गुड, यस सनी, इट इज लीवोडोपा. लीवोडोपा इज कंसिडर्ड एज द मोस्ट इफेक्टिव ड्रग. आई एम नॉट सेइंग इट्स द ड्रग ऑफ चॉइस, बट इट इज द मोस्ट इफेक्टिव ड्रग. Currently, what we give drug of choice is your drugs like pramipexole, the non-ergot derivatives जो हैं, ropinirole, they are better. और younger patients में you prefer MAO-B inhibitors like selegiline and all. The reason is because levodopa has side effects, and after 4 to 5 years, the side effects start appearing. So we want to delay that as much as possible. All right. Approved for on and off phenomena. This is the drug which has been approved for on and off phenomena. Yes, selegiline, MAOP inhibitor. Currently, there we have another drug which is no cefenamide. Cefenamide is another one which is a MAO inhibitor again. Cefenamide approved for off phenomena. Yes, yes, Dr. Meadow, cefenamide approved for off phenomena. Opicapone, ठीक है, COMT inhibitor है another opicapone. So very important this one. Transdermal patch available for Parkinsonism. Which drug is available as a transdermal patch available for Parkinsonism? Transdermal patch. No, it is rotigotine. Very good, Satyapriya. Yes, it is rotigotine. Rotigotine is a treaty as transdermal patch available for Parkinsonism. So all for exams, very important. Remember all the transdermal patches and what are their indications. Okay, so remember jitne transdermal patches hai and what are they used for. They are very interested in from roots. Usually transdermal patch is one important question. कि किसके लिए what transdermal patch is available. Libido reticularis is a common side effect seen with in the anti-Parkinsonian drug. Libido reticularis is a common side effect which is seen with which anti-Parkinsonian drug? Very good, amantadine. Drug of choice for drug-induced Parkinsonism. Drug of choice for drug-induced Parkinsonism. Very good, Dr. Mehta. Benzhexol. These are your centrally acting, yes, centrally acting anticholinergic, Benzhexol. So these are another important question I'll ask you is which vitamin is contraindicated with levodopa? Which vitamin is contraindicated with levodopa? Very good. Vitamin B6. Yes. Pyridoxine. Vitamin B6 is contraindicated with levodopa. Why? Because it helps or facilitates the decarboxylation or metabolism. Dopa decarboxylase का cofactor है, so it will enhance the metabolism of levodopa in the periphery. So it is not to be given with levodopa. But on the other hand, vitamin B6 is a must with which drug? Can you tell me? Vitamin B6 should be given with which drug? Very good. Yes, it is ATT, but which particular? Yes, excellent, all of you. It is INH. ठीक है, INH वैसे we will do next time. So INH का मतलब है isoniazid causes, N for neuropathy and H for it is very hepatotoxic. So because of the neuropathy, we have to give vitamin B6 alongside. ठीक है, so we can give it prophylactically also कि patient को develop ना हो any peripheral neuropathy. So ये are very important points to know about anti-Parkinsonian drugs. ठीक है, so levodopa very important topic out of this, and ये सारे पूछे गए हैं all in all the exams. All right, let's get to the another question now. Coarse tremors, dysarthria, ataxia are the side effects of. Coarse tremors, dysarthria, ataxia are the side effects of. Yes, please. Dr. Mitroid says 1. Okay, that is haloperidol. All right. Prakhar says 1 haloperidol. Achan Khan says lithium. Satyapriya says 1. Okay. Yogesh Damya says 1. Pankaj says lithium. Dr. Mitroid says especially to D2 blockers. Okay. Well, yes. Actually, जो ये 3 है, कोर्स ट्रेमर्स, डिसआर्थरिया, अटैक्सिया, डायरिया भी अगर होगा सारा, तो ये टॉक्सिटी एक्चुअली इज क्लासिकली सीन विद lithium. This is a classical, these are tremors जो हैं, they are seen with lithium. Yes, lithium, it is lithium. Now, important points. Now, lithium is one such drug. When I took the important NEET PG topics, वहाँ पे भी I had told that lithium, digoxin, phenytoin, valproate, these are few of the drugs which you need to know in and out and in depth. So, a lot of questions have been asked on this particular drug also. So, one point we discussed already, it has a very narrow safety margin. 0.5 to 1.2 ही इसका a safety margin. So it's a very let's say a drug which is there for therapeutic drug. We need to monitor it regularly because of this problem. A narrow therapeutic safety इसका margin है. ठीक है. Toxicity occurs when the levels go above 1.5 and then your problems of vomiting, diarrhea, ठीक है, and coarse tremors. देन व्हाट इज दिस, हमने अभी बात किया था डिसआर्थरिया, टैक्सिया, ये सारे शुरू हो जाते हैं अबव 1.5. सो द टॉक्सिटी अबव 1.5 स्टार्ट्स. Treatment of toxicity. So if the levels they go above 4 milliequivalent per liter, then we are supposed to do the dialysis. Above 4, then the treatment is dialysis. Most common side effect which is seen with lithium is your tremors. This is another important question. Most common side effect. Even this is another question. When the levels go above 4, then we do dialysis. ये भी पूछा गया है. And most common side effect with lithium, what are these? First is your tremors. It can also lead to hypothyroidism. It can lead to diabetes insipidus. It can lead to weight gain. Now, can you tell me what is the treatment of lithium-induced diabetes insipidus? What is the treatment for lithium-induced diabetes insipidus? Let's try to recall what we had done in the previous lectures. हमने the anti-diuretics and antidiuretics किए थे ना. So let's just revise. Which is the drug used for lithium-induced? Very good, Dr. Mitra. It is amiloride. Amiloride. So which is the drug used for nephrogenic diabetes insipidus? Can you tell me the drug used for nephrogenic diabetes insipidus? Nephrogenic diabetes insipidus. Yes, which is the drug used for nephrogenic diabetes insipidus? Very good, Odgura. It is excellent. Lena? No. It is thiazides. ठीक है? It is thiazides. Very good, Sandesh. It is thiazides. And what is the drug used for neurogenic diabetes insipidus? Neurogenic diabetes insipidus. तीनों के तीनों are very very important to know. ठीक है? Neurogenic diabetes insipidus, yes. Very good, all of you. No, it is desmopressin. Okay, so remember these three. Then this drug, lithium, is contraindicated in pregnancy. Contraindicated in pregnancy. Now, can you tell me what is the problem which is seen with this lithium? Very, very important. Again, this is a teratogenic drug. Okay, it is under category X drugs. Teratogenic drugs are under category X drugs. So what is the problem that it causes with the, yes, very good. It causes Epstein's anomaly. Epstein's anomaly. Excellent. Epstein's anomaly is yes. So it causes cardiac malformation, Epstein's anomaly. So ये सारे must know questions हैं, must know points हैं about lithium that you have to know. Okay, and it is a drug which you know it is used for Epstein's anomaly, and this is used for in mania, prophylaxis के लिए, bipolar disorder में हम use करते हैं, and these are the important drugs that you can give. So lithium, very, very important topic. All right. Sure. Let's go to the next important topic in CNS. Which of the following drugs can cause this? So if you see this picture, okay, and see properly the side effect, which of the following drugs can cause this? Okay, levetiracetam, lamotrigine, phenytoin, valproate. Dr. Metroy says 3, that is phenytoin. Okay. Or I want more answers. Just a second. Phenytoin. Okay, Pankaj says phenytoin. Yes, it is hirsutism. Excellent. So all of you are correct. It is phenytoin. And this is a side effect which is seen as hirsutism. Okay. So let's do now some of the important, again, anti-epileptic drugs. AEDs, anti-epileptic drugs. Very important topic. Okay, very important topic to know, anti-epileptics. So chalo, let's do some of the important side effects of anti-epileptics. Faster हम करते हैं फटाफट. Phenytoin is, इसका mnemonic है high hydantoin. ठीक है, high hydantoin, right? तो ये जो high hydantoin है, ये जो side effects हैं, they are seen at therapeutic doses only. Therapeutic dose. ठीक है, remember these side effects are not seen in toxicity, acute toxicity में नहीं, they are seen in the therapeutic doses only. When you use them for a period of time over a therapeutic dose में ही ये side effects आते हैं. So let's see H, I, G, H and hydantoin. So hydantoin हम पहले कर लेते हैं. This is your fetal hydantoin syndrome. So again this is a category X drug. ठीक है, fetal hydantoin syndrome. So one, you can say this can lead, H is for hirsutism. Hirsutism जो हमने अभी देखा phenytoin के साथ. I is for, one is for, it will induce vitamin D metabolism. And that leads to osteomalacia. Then it will interfere with folic acid absorption, causing megaloblastic anemia. G, gum hypertrophy or gum hyperplasia, gingival hyperplasia, whatever you want to call it. Then this stands for hyperglycemia 1, and then it can also lead to hypersensitivity reactions. Hypersensitivity reactions. These are some important side effects of phenytoin. Again, very, very important to know. Secondly, हमारा important drug है valproate, sodium valproate, valproic acid. Firstly, it is a drug of choice for many seizures like generalized tonic-clonic seizures, myoclonic seizures, atonic seizures, absence seizure, Lennox-Gastaut syndrome, सब में use होता है. And again, it has very, very important side effects which you must know. इसका आप mnemonic याद रखो, valproic, and you will remember the side effects. V is for vomiting, gastric side effects, nausea, vomiting. A is for alopecia. L is for liver toxicity. P, pregnancy, contraindicated. So this is the most teratogenic drug. Contraindicated pregnancy causes the neural tube defects or spina bifida. Spina bifida, neural tube defects. Okay. R, it can also lead to rashes. O, obesity, or you can say this leads to weight gain. Right? Yes. I, it causes increase in the tremors. And the C is for curling of hair. Curling of hair. So ये सारे important. Ataxia actually is a feature of phenytoin. If you give it in a high dose, patient next day develops ataxia. So when you give phenytoin in a high dose, that is a feature of phenytoin toxicity. So valproate, these are the important side effects that you should know. And valproic, phenytoin, carbamazepine, anti-epileptics, again the mechanisms are important. How do they act and which are the drug of choice for which particular kind of seizures. ये आपको आना चाहिए. It's serious if it gets, yes, Stevens-Johnson syndrome, but that is more commonly with the, you can see carbamazepine जैसे है, it is a drug of choice for partial seizures and it can be hepatotoxic. Very important is dilutional hyponatremia that it can cause, and it can lead to SGS and ataxia with carbamazepine. ये important है, and this is a drug of choice for partial seizures. This table you can actually see later on and important points note कर लेना. Topiramate, it can cause renal stones, weight loss. और weight loss इसलिए important है because इसकी वजह से now it is used for management of obesity. ठीक है, ट्रीटमेंट ऑफ ओबेसिटी के लिए यूज किया जाता है. Zonisamide also it causes renal stones. Lamotrigine causes rash and it can be as severe, especially in children में Stevens-Johnson syndrome. It can lead to very severe kind of rashes. Reticabine, or the other name for this drug is izogabine. Two names of the same drug. US में और यूरोप में ये different names से जाने जाते हैं. So it can lead to retention, blue pigmentation, and important is retinal toxicity. R for reticabine, R for retinal toxicity. Felbamate, hepatotoxicity. Because of this thing, anaplastic anemia, it is not used much. Then vigabatrin, the important side effect is your visual field effects. ठीक है, visual field effects. So ये कुछ important side effects थे of the anti-epileptic drugs. Again, these are must knows. ठीक है, ये आने चाहिए आपको anti-epileptics में से mechanisms, और अगर आपको इनके ये important side effects, and the third thing is which is the drug of choice for which epilepsy. ये तीन चीजें आपको इस chapter में से you should know. All right, let's head to the next topic, and that is your about this particular drug. A patient of biliary colic. A patient of biliary colic was given an injection after which his pain worsened. What do you think has been given to the patient? Patient of biliary colic was given an injection after which his pain worsened. क्या दिया गया patient को? So Dr. Metroy says 2, that is morphine. All right. Okay. Satyapriya says 2. Okay. Viran says fine, morphine. Okay, morphine. Yes, absolutely correct. This is morphine. Opioids में morphine. It is contraindicated in patients of biliary colic. Yes, because it increases the risk of rupture of the bile duct because it causes spasm of the sphincter of Oddi. So it has a tendency to cause rupture of. और अगर जैसे new patient आया है, lot of pain and there's a new intern and new doctor who doesn't know about it, उसने pain relief करने के लिए the doctor gave him morphine. So morphine से क्या होगा इस patient का? Patient से my pain has worsened or patient will be crying in pain. His pain will not be relieved. So better है for this you can give him NSAIDs to be on a safer side. So morphine is not a contraindicated in biliary colic. So morphine में और चीज़ें जो important हैं ADRs में, what are the important ADRs seen with morphine? Is your meiosis, ठीक है? Because it stimulates the Adinger westphal nucleus of the third nerve. Now this is a question and why I have written this because it was asked in one of the MCQs, what is the mechanism by which it causes meiosis? So it stimulates the Adinger westphal nucleus of the oculomotor, the third cranial nerve. Then it causes respiratory depression. So definitely there is a patient who already has a compromised respiratory functions. We will not be giving morphine, it will further depress the respiratory center. It further causes respiratory depression. Then it can cause nausea and vomiting. Then constipation, retention of urine. Okay, constipation, retention of urine. Dysphoria. ये important question है. Dysphoria is caused because of action on the which particular morphine receptor? And the answer is your kappa. It is not because of the mu receptor, the delta receptor, it's because of the action of the kappa. ये एक question आया हुआ है. So dysphoria because of morphine is due to action on which particular receptor? It is your kappa receptor. Now this one. Tolerance does not develop to which actions of morphine? Tolerance does not depend on which ADRs of morphine you can say. कौन से 3 actions ऐसे हैं? The tolerance does not depend on that. It does not develop to those. The mnemonic is CMC. ये 3 actions के लिए tolerance doesn't develop. So first T stands for constipation. So first C stands for constipation. Tolerance doesn't develop to constipation. Then M stands for meiosis. Okay, M stands for meiosis. And this second C stands for convulsions. So tolerance does not develop to these 3 actions of morphine. So very important to know this. ठीक है, मॉर्फिन के बारे में ये 3 चीज़ें और ये कुछ चीज़ें आपको चाहिए. एंड देन और क्या इसके बारे में? यस यू कैन रिमेंबर दिस ऑल्सो. 3 C's also you can remember: constipation, convulsions and constricted pupil. So you can remember the mnemonic of 3 C's or you can remember CMC. Anyways that you can find it easy to remember. और अगर poisoning होती है, opioid poisoning, acute poisoning, what is the antidote for this? ये भी question है. What is the antidote for acute morphine poisoning? Very good. It is IV naloxone. Shabash, all of you. Good. It is IV naloxone which is given for acute opioid poisoning. ये again सारे antidotes. Please remember all the antidotes and they are important. At least 2 or 3 antidotes will be asked. So this is one of the antidotes that are asked. एक हमने we have done previously so many antidotes, whether it is datura poisoning, alcohol poisoning, aspirin poisoning, paracetamol poisoning. ये सब poisonings के आपको digoxin poisoning आपको आने चाहिए. What are the typical antidotes? तो ये एक important है morphine poisoning. Now, चलो next question. This was a recent question in the FMGE exam. A patient presented with vomiting and ataxia. There were oxalate crystals in the urine. The patient was given ethanol and 4-methyl-pyrazole for the treatment. The likely diagnosis of the patient was methanol poisoning, ethanol poisoning, ethylene glycol poisoning, diazepam poisoning. So what is the correct answer here? Okay, Dr. Metroy says 1, Viran says 3. Let me underline the important things. See, one important thing here is oxalate crystals थे यूरिन में. दूसरी important चीज़ है उसको दिया क्या गया? Ethanol and 4-methyl-pyrazole for the treatment. Yes, Sandesh. Glycol, very good. NG Royal says 2. Ethanol की खुद की poisoning में we cannot give ethanol, so rule out ethanol. ठीक है? अगर आप 2 दोगे, how are you giving ethanol for ethanol poisoning? Yes, so the correct answer is ethylene. So the confusion here can be between methanol and ethylene glycol. तो अगर oxalate crystals हैं urine में, they are a sign of ethylene glycol poisoning, not of the methanol poisoning. So you can differentiate them. Otherwise, management remains the same, but to differentiate it is ethylene glycol poisoning. The solvent का है, ठीक है? Ethanol cannot be used in itself. और diazepam में हम ethanol poisoning use ही नहीं करते. What is the drug of choice for diazepam poisoning? What is the drug of choice in diazepam poisoning? Yes, what do we give in diazepam poisoning? Very good. We give flumazenil. This is another antagonist important. Flumazenil. इसमें दो एंटीडोट्स इंपॉर्टेंट है. एक फ्लूमाजेनिल है, दूसरा अभी हम करने वाले हैं जैसे हमने किया इथेनॉल फॉर इथाइलिन पॉइजनिंग और मीथेनॉल पॉइजनिंग. सो लेट्स डू दिस एक्चुअली हियर. ये अल्कोहल मेटाबॉलिज्म काफ़ी बार ये क्वेश्चन आता है. सो व्हाट इज द ड्रग ऑफ चॉइस which we give at various stages? Yes, very good. Salvation, very good. Now, identify which drugs are given at point number 1, which drugs are given at point number 2. So, which drug inhibits alcohol dehydrogenase? Which drug inhibits the aldehyde dehydrogenase? ये बहुत important question आते हैं. So, first can you tell me for point number 1? Ethanol is already given. Yes, very good. It is fomepizole. So this is fomepizole, drug of choice actually for methanol poisoning. ठीक है? No, disulfiram. Yes, number 2 is disulfiram. And if in this question, ये जो है ना 4-methyl-pyrazole, this is actually nothing but fomepizole. ठीक है? जो ये 4-methyl-pyrazole is another, actually it's a chemical nature or name of this fomepizole. So it is the same. So fomepizole is for the first, and second it is your disulfiram. उनकी मर्जी केमिकल नेम क्यों देते हैं, बट एक्चुअली क्या है आपको, इवन इफ यू डोंट नो दिस, इफ यू नो कि इथेनॉल दिया गया था, तो इथेनॉल इज अ ड्रग ऑफ चॉइस फॉर विच पॉइजनिंग, यू नो दैट, तो यू कैन मेक आउट. अगर आपको फोमेपिजोल नहीं भी समझ आता, सो मेक आउट फ्रॉम, दैट्स व्हाई दे गिव 2. ठीक है? सो नाउ यू नो दैट दे हैव अ टेंडेंसी टू आस्क दिस. एटलीस्ट सबका नहीं याद करना, अब इसका एक बार देख लो कि दिस इज हाउ इट कैन बी आस्क्ड. डोंट गो फॉर द अदर्स. ठीक है? डाइसल्फिराम यहाँ पे एक्ट करता है एंड फोमेपिजोल एक्ट्स हियर. सो दीज आर इम्पॉर्टेंट थिंग्स टू नो अबाउट दिस. और क्या इंपॉर्टेंट चीज़ें हैं फॉर दिस ट्रीटमेंट ऑफ अल्कोहल डिपेंडेंस? ये एब्सोल्युटली वेरी वेरी इंपॉर्टेंट. व्हाट आर द ड्रग्स यूज्ड फॉर अल्कोहल डिपेंडेंस? तो पहले है ड्रग्स विच आर गोइंग टू प्रिवेंट योर विड्रॉल. ड्रग्स आर गोइंग टू प्रिवेंट विड्रॉल. सो बेंजोडाइजेपिन्स आर यूज्ड, बट द फर्स्ट प्रेफर्ड ड्रग हम यूज करते हैं chlordiazepoxide. If it is not available or for some reason you can't use it, then we use diazepam. So similarly in the exam, if you are given both the options, then you mark chlordiazepoxide. If one of the option is given, then you mark that only. But अगर दोनों दिए हैं, then you go with chlordiazepam oxide for withdrawal prevention. But the drug to reduce the craving, which are the drugs which reduce the craving? I've already said, so remember, say no to alcohol. ये एक mnemonic याद रखते हैं, no to alcohol. So N is your naltrexone, O is your ondansetron, TO is your topiramate, and A is your acamprosate. So which drug is used to prevent withdrawal and which drug is used to reduce the craving? These are different drugs, so remember, for withdrawal, benzodiazepines, preferred one is chlordiazepam oxide followed by diazepam. And to reduce the craving, so no to alcohol, मतलब alcohol को हमने दोबारा नहीं लेना, ठीक है ना, तो उसको इसलिए कहते हैं craving reduce करनी है, so no to alcohol. So ये आप important points please remember from the chapter of alcohol. Alcohol में यही important है, और कुछ ज़्यादा important नहीं alcohol chapter में. Methanol poisoning, इथाइलिन ग्लाइकल पॉइजन में कौन सी ड्रग दे रहे हैं, जो हमने अभी किया. सो एंड अल्कोहल डिपेंडेंस में कौन सी ड्रग दे रहे हैं, दैट इज इट फ्रॉम दैट चैप्टर. वही दो तीन चीजें पढ़ोगे, यू आर डन फॉर दैट. ऑलराइट, नेक्स्ट वन. Another, this is also very recent question that I have taken up in this particular session. A patient not responding to haloperidol and thioridazine, a patient was not responding aayega, so a new drug was added. So after adding the drug, what happened, the patient complained of excessive salivation, hyperlipidemia, weight gain, hyperglycemia and sedation. So what is this new drug? Okay, so what you have to see here is, पहले हम कौन सी class of drugs दे रहे थे, we were giving antipsychotics, typical antipsychotics, but patient was not responding, and then we try to add a newer drug. So जब typical काम नहीं करती है, then you try to give an atypical antipsychotic for the resistant cases. The best drug which is given for resistant cases is clozapine. Drug of choice for resistant schizophrenia is clozapine, and all these effects, excessive salivation, as rightly mentioned by Satyapriya, is a wet pillow syndrome जिसे कहते हैं, for hypersalivation, wet pillow syndrome. This is classically seen with clozapine. So they've given you a hint there what can the drug can be. Hyperlipidemia, weight gain, hyperglycemia, sedation. It causes a lot of sedation, metabolic syndrome, everything that is seen with this atypical antipsychotic. ठीक है, ये atypical antipsychotic है जो ये cause करता है. So ये एक important feature है clozapine, और ये clozapine is the most important drug asked from atypical antipsychotics. Many times इसी पे question आया हुआ है on the atypical antipsychotics. So क्या important side effects हैं for clozapine? It can cause seizures, but this is dose dependent. So if you give smaller dose, less chance है, higher dose, more chances. So definitely if there is an epileptic patient, we will not give such a drug. Seizures, agranulocytosis, very important. So one of the question, again it was asked in the recent exam, that you have given a drug to a patient or an antipsychotic to a patient, and it requires regular monitoring of the blood counts. Which drug would you think is causing this? Again, this the option था, agranulocytosis का उन्होंने hint दिया था, and the drug is clozapine. तो इसके बारे में the question can be twisted from here on there, but इसके बारे में पूछते हैं. So agranulocytosis, remember, so you have to do the counts regularly in such cases. Myocarditis, sedation, cyalorrhea जो हमने बात किया, wet pillow syndrome, and it is a drug which causes the metabolic syndrome, जो hyperlipidemia, weight gain, and the glucose जो metabolism में problem cause करती है. So ये सारी चीजें are associated with clozapine, and this is only given for resistant schizophrenia, not for the otherwise because of the side effects. ठीक है, and some important points about the other one. जो risperidone है, remember risperidone has a high risk of causing extrapyramidal syndrome. out of the atypical. Otherwise, typical antipsychotics cause extrapyramidal syndrome. But out of the atypical one, this has the highest risk of causing the extrapyramidal syndrome. Ziprasidone, इसके spelling में zip आता है. What is the important point to remember? QT prolongation. So, especially the Torsades D pointis. Now, if you say Torsades D pointis का जो ECG है, it is something like this. ठीक है? ऐसे करके फिर ऐसे ऐसे. So, it's like this. So, एक zip होती है ना जैसे, like this. If you see a zipper, so it's like this. So, that's why remember Torsades D pointis like a zip shape. So, the most common atypical antipsychotic causing this is your ziprasidone. Quetiapine. It causes a lot of sedation and it can lead to cataract formation. So, ये कुछ important points है about the atypical antipsychotics. Now, side effects with typical antipsychotics. ये एक side effect है जो they ask you about what are these side effects, or they will ask you the treatment. Which of the following antipsychotic causes this? So, they will be giving you a typical antipsychotic, or they'll be asking you a typical antipsychotic cause this side effect. So, what is the treatment? Okay, so this is the extrapyramidal syndrome. Similarly, whether it can cause acute dystonia. So, mnemonic hai adapt. So, adapt में acute dystonia, it is the first to appear. And T is for tardive dyskinesia, which is the last to appear. So, it is in order. Acute dystonia earliest. Yeah. So, acute dystonia earliest and the tardive dyskinesias. Yes, weight gain, as I said, it is already a part of metabolic syndrome only. तो वहाँ पे मैंने mention किया था he can cause weight gain also, clozapine. So, acute dystonia earliest and tardive dyskinesia सबसे last में होता है. तो ये remember कर लो, adapt. And दूसरा A is for akathisias, P is of Parkinsonism, Parkinsonian-like symptoms, and the T is tardive dyskinesia. Now, जो last में होता है इसका malignant neuroleptic syndrome, it is not related to the time. It can occur anytime with any dose. So, it is not time related. ये जो बाकी हैं, they are time related. मतलब सबसे पहले होएगा acute dystonia. Akathisia is the most common. ठीक है? Most common, but this is the earliest, this is the last. And the treatment part, acute dystonia and Parkinsonism, it is your centrally acting anticholinergics. Akathisia has more of, the anxiety level ज़्यादा हो जाता है उसमें, and you need a drug to suppress the sympathetic activation. So, यहाँ पे आप drug, beta blocker is a drug of choice. The first choice is propranolol, not we can use benzhexol here also, but यहाँ पे the first choice is propranolol. Then tardive dyskinesias के बारे में, the two drugs approved is your valbenazine and deutetrabenazine, and these are the approved drugs. Or malignant neuroleptic syndrome, we know dantrolene is approved, and the second one is bromocriptine, and is the most fatal. अगर ये हो जाता है तो patient can really lead into serious consequences. So you have to stop the drug at this particular time अगर malignant neuroleptic syndrome होता है. So dantrolene is a leg of choice. Also dantrolene और कहाँ पे यूज होती है? It is in the malignant hyperthermia. Malignant hyperthermia में भी drug of choice is your dantrolene. Halothane, succinylcholine, वो drugs cause करते हैं malignant hyperthermia. So there also it is used. So ये important है typical antipsychotics. The most important thing you should know about the typical antipsychotic is, apart from जैसे वो classification से ज़्यादा mechanism what is your this side effect. ये table आपको आना ही चाहिए for typical antipsychotics. कि what happens with the typical उसकी treatment क्या है, because this has been asked. So this table can help you in that. ठीक है? Okay. Now coming to the last question for the day is this one. Inducing agent or inducing anesthetic agent of choice in shock is. Inducing anesthetic agent of choice in shock is agranulocytosis with clozapine. Yeah. Shock में, which is the inducing anesthetic agent of choice. So that says 2. Okay, choice says 2. All right. Good. Yes, good to go. Yes, that is the correct answer. Ketamine. Very good. Ketamine, Shivam. So ketamine is one drug which actually increases sympathetic, system पे effect होता है. So it is useful in the patients of shock. So enhances that. So it is one of the drugs of choice in hypovolemia or in shock. It can be used. कुछ very very हम quickly because anesthesia में कुछ important और questions. There are a lot of questions, but are the important questions asked from anesthesia. Let's discuss this fast, which is important thing to know here. Most common drugs. So all these are MCQs. I already say quick shots are all MCQs. They have all been asked. Most common drug used in daycare surgery is. Yes, tell me. Most common drug used in daycare surgery is. Rather, I will tell you anesthetic drug. Because we're talking about anesthesia, please understand this is anesthetic drug used in daycare surgery. No, not thiopentone. No. General anesthetic. Yes, you general anesthesia की बात कर रहे हैं, ठीक है? So एक और specification. Lignocaine is a very commonly used local anesthetic. Local anesthetic is हम general anesthetic की बात कर रहे हैं. Isoflurane no. Desflurane no. Because desflurane is very irritated to the bronchus. Excellent, yes, excellent salvation ship. It is propofol. Propofol. No. Bupivacaine local anesthetic है. Propofol is the most common drug in, yes, it is in daycare surgery. Okay, I'm refer to, this is all about general anesthesia. So let's focus on general anesthesia. Drugs showing property of redistribution. General anesthetic, और this is a very important example of जब भी हम redistribution की बात करते हैं हम इस drug की बात करते हैं. Which is that drug which shows important property? Very good. This is thiopentone. Thiopentone. Yes, thiopentone. Excellent. Yes, thiopentone. General anesthetic which can cause adrenal suppression. Yes, all of you are absolutely correct. General anesthetic which can cause adrenal suppression. Okay, I'll tell you. It is etomidate. Etomidate. It can cause adrenal suppression. Induction anesthetic agent of choice in children. Induction anesthetic agent of choice in children. Very good, Siddharth. Yes, it is. Induction anesthetic agent of choice in children. Very good. Yes, it is ketamine. No, it is ketamine. Inhalational anesthetic agent of choice in children. Inhalational. It is ketamine, yes. Inhalational anesthetic agent of choice in children. Very good salivation. It is sevoflurane. Anesthetic agent preferred in bronchial asthma. Anesthetic agent preferred in bronchial asthma. Yes, Shiva, all of you are correct. Anesthetic agent preferred in bronchial asthma. No, bronchial asthma. It is again ketamine. It is again ketamine. Okay? Okay, I'll ask you another one. Which anesthetic agent causes maximum irritation to the bronchial pathway? Maximum irritation to the bronchial pathway. Yes, it is ketamine. Which anesthetic agent causes maximum irritation to the bronchial pathway? Halothane? No. Yes, very good, Siddharth. It is desflurane. It is desflurane. ठीक है. अब 3-4 questions quickly करते हैं about local anesthetic. I will ask you only quick short सी करेंगे, not the MCQs. Which local anesthetic is a vasoconstrictor? Which local anesthetic is a vasoconstrictor? A potent vasoconstrictor. Quickly, कौन सा local anesthetic is a vasoconstrictor? बात हो ही रही है. Adrenaline is not a local anesthetic, बेटा. It is a vasoconstrictor, yes, but local anesthetic नहीं है. Which local anesthetic? No, not bupivacaine. It is, okay, I will. It is cocaine. Inhibits the reuptake of noradrenaline. तो noradrenaline release होकर क्या करेगा? It will act on the blood vessels, leading to alpha-1 stimulation. No, that is different. Alpha-1 stimulation causing vasoconstriction. This is, we combine adrenaline with lidocaine because adrenaline is a vasoconstrictor or lignocaine is a this local anesthetic. So when you want to enhance the effect of lignocaine, then you add a vasoconstrictor like adrenaline. मैं इसमें पूछ रही हूँ which local anesthetic in itself is a vasoconstrictor. Otherwise, all local anesthetics usually vasodilators, except for this one, which is your cocaine. Which local anesthetic has maximum cardiotoxicity? Which local anesthetic has maximum cardiotoxicity? Thiopentone is not a local anesthetic. Local anesthetic which maximum cardiotoxicity. Lignocaine, no. It is the most commonly used. अगर इतना cardiotoxic होता है, इतना common क्यों use करते हैं उसको? Not lignocaine. Excellent, yes, Siddharth. It is bupivacaine. It is bupivacaine. Most cardiotoxic is your bupivacaine. ठीक है? All right. Now I will write the name of an anesthetic, which is your prilocaine. Now can you tell me, because whether it is an ester or an amide? It belongs to which class of local anesthetics? Ester or an amide? फिर I'll tell you a trick to remember कि esters कौन से होते हैं, amides कौन से होते हैं. Prilocaine, ester है कि amide है? Dr. Metroid says amide. Oh, so amide. All of you right. तो फिर you know how to identify it is an amide. कैसे? How do you identify? Two, very good, Srihari. जिस भी local anesthetic की spelling में 2 times I आएगा, that will be an amide. Because amide के पास खुद एक I है, एस्टर के पास कोई I नहीं है. तो जिसकी spelling में 2 बार I आता है, that is an amide because amide itself has an I. It can donate one I to the other drug. ठीक है. So ये एक very important to know in case they ask you the classification. ठीक है. And okay. Adrenaline with local anesthetic is contraindicated. In which case? Normally though you give this, but where do you think they are not to be given together? Adrenaline with local anesthetic, contraindicated in which case? Very good. End arteries. ठीक है. So all the end arteries में we will not give adrenaline with the local anesthetic. Even in the Beer's block, we should not give adrenaline along with the local anesthetic. Yes, end arteries. एंड इन द बियर्स ब्लॉक, ठीक है, जो आईवी यहाँ पे हम जहाँ पर कफ लगाते हैं एंड यू गिव लोकल एनेस्थेटिक हियर व्हेन यू हैव टू डू प्रोसीजर ऑफ द अपर लिम्ब, को कोई प्रोसीजर करना है, सो देयर ऑल्सो यस इट कैन कॉज गैंग्रीन बिकॉज ऑफ द डिक्रीज सप्लाई टू दैट एरिया, सो वी कैन नॉट गिव दिस. Okay, so adrenaline with local anesthesia. Quickly, can you tell me why we combine this? This is the last question of the day and we'll wrap up. हम ये combine क्यों करते हैं? Adrenaline with local anesthetic. Give me 1, 2 and 3 reasons. First reason, why we combine adrenaline with local anesthetic? One is increases the duration of action of local anesthetic. Then decreases the blood loss. And third reason. Very good, excellent automatic. There is no or less decreased systemic toxicity. Okay, so these are few important pointers about the local anesthetic. And then you should also, isme mechanism of action is yes, long acting mechanism of action, because they go inside the axons and they act on the sodium channels which are in the active state, and they will prolong or they will convert the active state of sodium channels into the inactive state. So they work from inside, bahar se andar aayenge into the nerve and then they work. तो ये भी इंपॉर्टेंट है कि वो बाहर से काम नहीं करते, अंदर आके काम करते हैं. बाहर जितना बेसिक नेचर होता है एंड बेसिक मीडियम इंक्रीजेस देयर एफिशिएंसी, because then they themselves are weak bases, they will be unionized in weak media, more of the drug is going to be absorbed into the nerve, and then वहाँ पे acidic media है, they will get ionized. The ionized form actually acts on the receptors of the local anesthetics which is present there. ठीक है, सो रिमेंबर दैट एज द मैकेनिज्म ऑफ एक्शन. ये कुछ इंपॉर्टेंट पॉइंट्स थे अबाउट लोकल एनेस्थेटिक्स, जनरल एनेस्थेटिक्स, सीएनएस, रेस्पिरेटरी सिस्टम. तो सीएनएस में आई ट्राई टू टेक वन क्वेश्चन फ्रॉम ईच चैप्टर सो दैट वी हैव अ rough idea and we can revise the important points that have been previously asked. So please, whenever you get time, go back, revise and see ये points cover होने ही चाहिए. About what? pH. Okay, let me tell you. Here. ये नर्व है, ठीक है, एंड इसके लेट्स मेक अ रिसेप्ट. यहाँ पे सोडियम चैनल्स हैं, ठीक है, सोडियम चैनल्स हैं. सो ये नर्व का अंदर वाला पोर्शन, यहाँ पे एसिडिक पीएच है, यहाँ पे बेसिक पीएच है. लोकल एनेस्थेटिक्स, दीज आर bases, weak base. So, you know, basic drug in basic media, they remain unionized, and जो unionized fraction होता है, it can easily be absorbed. So, local anesthetic will enter inside the nerve because the receptor for the local anesthetic is present inside. It has to enter inside to act on its receptor. So, now when local anesthetics has entered inside, now it meets the acidic pH, so it will get ionized. In the acidic pH, ionized fraction क्या करेगा? It binds to the sodium channel. So active channels को bind करता है and it will convert this active channel into an inactive sodium channel. And you know when the inactive channel होता है, sodium cannot enter inside. And sodium will not enter inside, the action potential will not be generated. And वो जो pain का impulse है, that will not be transmitted. Patient will not feel pain. That is the main mechanism of action of local anesthetic. ठीक है? I hope I'm clear. So इसमें basic में अगर हम किसी भी कारण pH को और basic बनाएंगे, it will enhance the action of the local anesthetic. That is alright. Alright. So let's wind up with this last topic. I hope you could make some use of it and try and later on जब इसका recording देखोगे, so when you are practicing or when you are doing the questions from this particular chapter, go and revise this and try to solve as many questions as possible. And these are the important topics जो मैंने कहा था, they are Obviously you have to know, you cannot go to an examination hall without actually revising these topics. My whole aim of taking these sessions is that ये वाले जो questions है, you have to know them. ठीक है, if you don't get time for here and there, but ये वाले questions आने ही चाहिए. Next session, I will let you know, because next session is, it is planned next week, but dates are not decided. So I'll definitely put it up here, because abhi there are one or more sessions. I'll let you know, Ragmetroid. Abhi dates I am not clear. Next class, it will be up here. यहाँ पे आप देख लेना. It is next week definitely, but which day I'll let you know. ठीक है. बाकी Unacademy, if you're there on channel, they will definitely put it up, so you can see कि upcoming कब है. And next session will be on antimicrobials, general antimicrobials. I am taking antimicrobials in 2 sessions. One is the general and the other would be the specific, as well as the cancer, anti-cancer drugs. So general antimicrobials I'll be taking up first. So it may be a little earlier as compared to Saturday, but definitely I'm going to take. It's showing 29th, 29th of June. Then it must be on 29th only, because there are 2 or 3 sessions, so I'm getting confused कि ये वाला कब है. So it must be on 20. If it isn't showing 29th, then it is 29th. What was the purpose of replacing MCI? It's like government. No, one government replaces the other government. So it's that way. Whoever wins more, has more followers and इनके votes ज़्यादा and they win. So let's not worry about them. Let's worry about only ourselves. ठीक है. All right, guys. So have a great Sunday evening. So see you next time. And in case there is any query, yeah, you can put it up in the comment section, or you can ask me, on my Insta channel, or wherever you feel, and I will definitely answer that. Okay? Take care, all of you. Thank you so much.